Hey, my name is Jeremy and welcome back to another episode. Today we're going to be showing you what's inside a cricothyrotomy kit. We're going to open it up and take a look inside, and we're going to learn how to do this procedure in the next video.
Alright, so we have an emergency cricothyrotomy catheter set that we're going to be opening up. Let's see what's inside. Okay, starting off we have our ChloraPrep, and we have our dressing that we have here. So once again, in the other videos, you could do a taco approach where you peel this off and then you kind of hold it like a taco before applying it to the patient's skin, and then unfold it. So the first layer is about cleaning it and then setting up for the procedure. And upon opening the kit, everything was in shambles, so we had to reorganize everything. All right, in this kit, on the left side you have your Seldinger technique, which you can use for this procedure, and then on the right side you have the classical approach. These are going to be your universal tool right here because you need a tracheostomy tube. Outside of that, left side, first thing that we would need to do is use our incision to create a vertical line between the thyroid cartilage and the cricoid cartilage. Then you get your needle, and they give you two different needles. They give you the catheter that you could slide into the trachea, or you have your large bore needle. So this you would just hold at a 45-degree angle and start inserting right at the cricothyroid cartilage. Hopefully get some air that you would aspirate. Then you would use your straight guide wire to put that into the site. You would pull out your needle, and then you would get your tracheostomy tube with your dilator combination, load that in, and then insert that into the trachea, pull out, and inflate your balloon. So that really is all that is involved in the Seldinger technique. You would obviously then secure it with this up there. And then on the right side you've got your classical tools. You've got your much larger blade that you would use to do your vertical incision, followed by your horizontal incision. And after that you have your tracheal hook, which you just put into the incision you make and pull back on the trachea. And you have your Trousseau's dilator that you would grab and then insert that into the tracheal hole that you made and just dilate it and make that bigger. And unlike the Seldinger technique, where you're going to use a dilator inserted into the tracheotomy tube, you have your obturator, which you're going to use. So you insert that in like this. It makes the insertion a whole lot more smooth and rigid, and you insert that into the trachea and remove it, and then you're all set. Then you would just inflate your balloon and clean up your sharps in the sharps container, and you're done with the procedure. So that's really what's involved in this kit. It's nice they kind of give you both options depending on what you're more comfortable with, but that's what's inside.
Thank you guys for watching, and stay tuned for more videos.